Okay, good morning, everyone. I will be discussing our last topic for your ang tawag nito, fluids and electrolytes. No? Gina-try lang nako no kung sa itong feeling nga may mong gwapo ba no. Okay. Okay. So for today we'll be discussing three topics. You have there your neurogenic bladder, you also have there your renal failures, your chronic and your acute renal failure, and lastly, of course, your renal calculi. That means that your renal stones. Okay. So without further delay, let me just share my screen to you. Kamusta na kayo? Kamusta na kayo? I cannot be with you no, during this last session kay na ang mga ginatawag nga Teacher's Day. No, it's our day for today. Ayan. So let's talk about mabilisan lang ito no para hindi kayo maboard. Urinary elimination disorder. This is number one, your neurogenic bladder. Pag sinasabi natin neurogenic, it has something to do with your nervous system and at the same time, your urinary bladder. Okay? So, ano bang nangyayari dyan? Okay, we will be discussing that one. For your neurogenic bladder, uh, let's talk about let's try to review first your anatomy and physiology. Your urinary bladder malfunction due to your neurologic dysfunction emanating from internal or external trauma. That means that physical, no matter physical, na kayo. Okay, disease or injury, interference of the bladder. You have here your brain, okay, but you have to remember class, no? Pons. Okay, that is basically the one responsible. That is the part of the brain which is responsible for the controlling or regulating your urination. Pero aside from that one, it is the part of the brain. Meron din tayong tinatawag na spinal cord, which is part of your CNS or your central nervous system. It plays like a pathway whenever you're going to do urination or you're not going to do urination. It still plays a role. I will be discussing that one later. Interference of the bladder normal mechanism caused by the disruption of the central and peripheral nervous system. So remember, pag sinasabi nating central or your CNS or your central nervous system, that is basically talking about your brain and your spinal cord. And then for your peripheral nervous system, you just have to remember the division there. You have there the somatic, I'm sorry, motor muna, motor, and then you have there your sensory. Okay, your sensory is the one receiving the external stimuli or receiving any impulses, or I'm sorry, not impulses, receiving the stimuli, no, from the outside or from the external or even in the inside. No, meron man din tayong mga receptors dyan. Okay, that monitors the changes in our body, such as your pag-iihi. Okay, the urgency to void. Ayan. Okay, so it receives signal na sasabihin na, oy, okay, overstretch na ito. It will send impulses now to your spinal cord papunta sa iyong CNS. So magsa-start talaga yan sa sensory. And then from the sensory, it will now go to your CNS via your pathway, which is your spinal cord. And then aakyat na yan sa brain. The brain will analyze and then will respond or will give an analytical impulses back to your motor. Okay? Kasi ito na yung effector natin eh. So your motor, it could either be autonomic, and you also have there your, tanggalin natin to, somatic. Okay? Somatic, these are voluntary reflexes. I'm sorry, no. Reflexes tapos voluntary, no. These are voluntary movements. So dito yan siya pupunta yan sa yung autonomic, okay, which is governed by your para and your sympa. Okay, parasympathetic nervous system and your sympathetic nervous system. I will try to, not really try, I will discuss this one kung paano ito maaapektuhan. Okay, but again, you have there the receptors, your sensory neurons will pick up this stimuli and then it will convert it into your impulses papunta sa inyong spinal cord, papunta paakyat sa brain niyo. And then your brain will try to analyze and then it will send signal back to your motor kasi nga effector na ito siya eh. Okay, this is your afferent. And this is another term for your motor neurons. This is your efferent. There is an effect already. You will be expecting an effect, okay, coming from the impulses from the brain. Okay, ang sensory natin, it carries impulses from the sensory going to the brain, and then the brain will now give back the impulses going to your motor. Okay, so sa autonomic natin, it is governed by your parasympathetic and your sympathetic. Okay, yung para natin, 'di ba, the effects of your parasympathetic nervous system sa ating urination is that it contracts your detrusor muscle. Sir, asan ba yung detrusor muscle? It is basically the muscle that lines your urinary bladder. Okay? And anong kuan? Unsay pulos aning sympathetic nervous system? Basically, it will now try no if it is if your sympathetic nervous system is governing your body. Sir, kailan ba tong sympathetic nervous system? During fight or flight, during when you're having any activity, extraneous activity, mga exercises ninyo, it will try to give a high pressure to your urinary sphincter para dili na siya mag-relax and mag-release og urine. Kuha na to? Okay, ayan. So for the neuroanatomy, the normal function of the urinary bladder is to store and expel urine in a coordinated, controlled fashion. This coordinated activity is regulated by the central and peripheral nervous system. Central natin yung sa brain, more specifically, yung ating pons. And to be more specific, you have there your PMC or your pontile micturition. Pag sinasabi natin micturition, this is now the formation of your urine. Micturition center. Okay, kasi sa pons natin, itong PMC is located. Okay, normal voiding is essentially a spinal reflex modulated by central nervous system, brain, and spinal cord. Pag sinasabi natin spinal cord class, remember this one. No? Baka malito kayo. Meron tayong tinatawag na vertebra or your vertebrae, or your vertebral column. So you have their C1 to C7. You also have their thoracic 1 to thoracic 12. You also have there your lumbar 1 to lumbar 5. Okay? These are now yung disc ninyo. Okay? These are now talking about the bones. No? Pag sinasabi naman nating spinal cord or your spinal nerve, okay? Meron din tayo mga divisions dyan. You have there C1 to C8, T1 to T12, okay? You also have there your L1 to L5. You also have there your S1 to S5. Sir, ano ba yung S? Sacral. Sir, bakit walang ganun sa vertebra? Vertebrae. Oh. Sir, bakit wala? Okay, here's the thing, okay? Ang ating sacrum, isa lang yan. It is fused. No? Unlike your other vertebra, the one that is superior to your sacrum, okay? Anong tawag dito? Separated kasi yan sila. Okay? Your sacrum and your coccyx, no? Yung tailbone natin, okay? Yung coccyx natin, that is just fused. Okay? But here in your spinal nerve, na-adjutana. S1 to S5, and of course, your coccyx, which is only 1. I don't know if it's double C but ang coccyx ninyo. You just have to try it. Look na lang. Okay? So this is now ang nag-govern sa ating, how do you call this, sa ating urination, it's more on your sacral area, sacral nerves, the one that innervates, no, yung ating, when we say innervate, okay, innervate, ito yung tinatawag natin na it supplies the nerve. Okay, so question, what innervates your urinary bladder? You have there your S1 to S5. Kuha natin, those are the nerves that supplies your urinary bladder and your urinary sphincter. Okay, kuha natin. So for your quick review, if this is the bladder, okay, ayan, pinaka-small yung bladder natin. Okay, you have there your urethra. Isang ahas yan. Okay, of course, andito yung kidney natin. Ang liit ng kidney, ang laki ng bladder. Okay, anyways, ganito yan. Okay, and of course, you have the adrenal gland. Okay, the only or the one that we are after here sa inyong urinary system is, of course, this one. You have there your urinary bladder, and of course, you have there your urethra. Okay, but basically, dili good sa urethra, you have here a sphincter that is called your urinary sphincter. Now, during micturition or formation of your, how to call this, of your urine, magsustorm man yan sila dito. Of course, it starts with your kidney. Now, your kidney filters your blood, and that filtration will basically form your urine. Okay? Ang nangyayari dito is that if ever wala ka pang urgency, okay, wala pa tong urgency, no urination. Okay, buta na to there. No urination, and then yes, urination. So manang no ug yes. Wait lang. Okay, urination. Pag hindi ka pa umiihi or you do not feel the urge yet, okay, what happens here is that there is a high pressure. Saan? Sa inyong urinary sphincter. High pressure on the urinary sphincter. Sir, bakit? Okay? Kasi if ever low ang pressure sa inyong urinary sphincter, it will now open. Lalabas yan siya. Okay? So dito, you have there number one, increased pressure and also decreased pressure ang ating urinary bladder. Kuha natin. And of course, kung dito naman siya, if you're already feeling the urge of urinating already, decrease ang pressure sa ating urinary sphincter, no, para mag-open yan siya. And of course, there is an increased pressure in your urinary bladder. No, it is an opposite no mechanism. Okay, kasi during that time already, magko-contract na ngayon yung ating detrusor muscle sa ating, how do you call this, urinary bladder. Okay, and that contraction of your, kasi here's the thing, during micturition, mupundo man ang ihi ni mo dire. Slowly, it will stretch your urinary bladder until such time it will reach a mark wherein it will send signal. Okay, meron tayo mga receptors tayo dito eh. It will now send signals. Pag stretch na yan siya, that's what we call your stretch receptors. Okay, pag once mag-reach na yun siya, yung pag-stretch niya, it will send signal, or that will send that stimuli. That is already a stimuli. It will send to you. It will be received by your sensory receptors, and then from there it will change that stimuli into impulses papunta sa inyong brain via your spinal cord. Okay, that is very important to know, via your spinal cord, kasi nga the etiology or the cause of your neurogenic bladder for it not to function are of course injury to your spinal cord. Meron tayong tinatawag na SCI or your spinal cord injury. Meron din tayong maybe infection, CNS lesions sa ating brain, may infection sa brain, may problema yung brain, trauma to the brain. Kuha natin, pwede rin tumor to the brain. May it be malignant or may it be benign. Okay? Gina-compress kasi kung may tumor, gina-compress yan siya. And what if naapil o compress dito ang pons ninyo? Okay? Because your pons is the one responsible for a coordinated urinary reflex. Okay? Kuha natin. So ayan yan siya. Okay? Now, after that one, it will now, of course, those impulses will go to the brain, and then your brain will analyze that one, and then it will emit those impulses back to your motor. Okay, specifically pag ano sa motor, pupunta sa autonomic nervous system. From the autonomic nervous system, of course, you will now have a control, or you will it will now affect your parasympathetic and sympathetic. Okay, now sir, paano ba yan papasok yung ating para and sympa? Ganito yan siya, class. Sa sympathetic natin, for your sympathetic response, okay, what happens here, ano ba yan? Kung sympathetic nervous system yan siya, that means that ayaw niya ikaw paihiin. Okay? Ayaw. Okay? It will not stimulate to, it will not let you stimulate to, anong tawag ito, urinate. Okay? That means that your sympathetic is the one responsible for giving high pressure to your urinary sphincter, no, to be contracted all the time. Okay? Now, next is, okay, so your, of course, you have your urinary sphincter. Sphincter, ayan, close. Naka-close yan siya kasi contracted eh. Okay, nagkakaroon ng contraction. Okay? Now, you also have here yung para ninyo, parasympathetic. Okay? It will now inhibit sa ating urinary sphincter. Kung ito dito close, you have your urinary sphincter. Okay? Mag-o-open yan siya. There will now be an opening. Magre-relax. It will now inhibit the action of your sympathetic nervous system. Now, para mag-open yan siya, and at the same time, there will be contraction of the detrusor muscle. Okay, kuha natin. Ayan. So sympathetic then it will allow no your bladder to stretch as well. No, it will allow the bladder to stretch. So allowing bladder to stretch no during the filling of your urine doon sa ating urinary bladder. Okay? Now, here's the thing. Remember, sabi ko sa inyo that basically what governs your urination or your micturition is basically your pons. Aside from your pons, to be more exact, it is your pontile micturition center doon sa pons ninyo. And then it also has there yung ating spinal nerve. Okay, or your spinal root or your spinal nerve that governs it, or your spinal nerve serves as a pathway for impulses to be transferred. Okay, so pag may problema tayo doon sa dalawa, okay, it will now affect. Ano bang nangyayari sa ating neurogenic bladder? If magkakaroon tayo ng neurogenic bladder, you will not have no control of urination. Okay, so magkakaroon ng spillage of your urine. Hindi na natin nakokontrol, or we may not be able to feel the urgency to void anymore, or magkakaroon tayo ng overactive na bladder. Sige lang siya contract, kasi nga wala nang nag-regulate eh. Okay, it loses its ability to sense that puno na ako. No, kahit hindi pa puno, lumalabas yung ating ihi. Okay, and there's a term for that one. I will be discussing that one later. So ito din siya class. Okay, aside from your physiologic, no, yung ating neurogenic bladder, that is basically your pathologic. Emotions experienced in higher brain centers may exert downstream effects on the PMC, or your pontile micturition center, which is why some people can experience incontinence with excitement or fear, or strong emotions. Share strong emotions. Maugani na, there is a joke, no? Kapag kiligon ka, kilig ka sa imong crush, kaihiun, makaihi. Because of those strong emotions, no? And there are also times wherein pag takot ka, you tend to pee, no? You will not move, tapos you tend to pee. Naiihi ka sa sobrang takot mo. Or even sa sobrang excitement mo, naka-scream ka for joy. Woo! Pasado ako. Kasi alam ko, papasa kayo sa nursing board exam eh. Claim it, to God be the glory. Pagkabak mo, woo! Kaihi. Unsa to, sir? Woo! Nakaihi ka. Okay? Because of, they can experience incontinence, no? With excitement or fear or yung strong emotions natin. Sir, tanong, ano ba itong incontinence? Leaking of urine. Dadara. Muna mo saya, itong mga brief o panty, baho-baho na siya. Apang, mapanghi yan siya kasi meron times na siguro po walay tarong trapo, or if ever may problema, naglilik yung ating urine doon. Okay? So for your pathophysiology of your, I think I've already explained this one. If a problem occurs with the nervous system, yes, sinabi mo to, including the brain, pons, spinal cord, sacral cord, yung sa S1 to S5 natin, di ba? And peripheral nerves, a dysfunctional voiding. Okay, condition results in different symptoms. I will be discussing about the symptoms later, ranging from acute urinary retention, pwede rin pala, retention of your urine, okay, to an overactive bladder, or to a combination of both. Okay, so meron tayong incontinence and meron din tayong continence. Okay, when we say incontinence, sinabi ko na to sa inyo kanina, no control. No, wala ka ng control of urination. No control. So mag-free fall na lang, yung free dive na yung mga urine ninyo. Okay, and then continence is basically the opposite of your incontinence. Continence. Meron din another opposite of your incontinence, retention. Okay, so pwede dito ma-experience or both, no, in your neurogenic bladder. Okay, now these are the symptoms of your neurogenic bladder. Dito natin ilagay aking mukha. Ayan, overactive bladder. Lang baka nag-record ako tapos hindi ko to siya lang class ha. Baka hindi ito siya nakakuan. Wala kayong marinig mo na yan. Test speed. Yes, mic test. Yan. Okay, ready. So going back, overactive bladder, meaning Si kag-ihi, ana, you don't have any control when your urine will be excreted already. Frequent urination, no, during the daytime and nighttime, or the term there is your nocturia for the nighttime. Okay? So meron tayong polyuria, okay? Frequent urination or your polyuria. Okay? Stress incontinence. 'Di ba sabi ko sa inyo wala ka ng control sa paglabas ng ihi mo. Lumalabas lang siya kusa, no? In some cases you have here your stress incontinence. Stress incontinence, ito yung pag-ubo mo. Ubo ka, gawas imong ihi. Okay, nag-atching ka, atsu, gawas imong ihi. Ano gud ko kay gitan na ako kung mugawas pod ba akong ihi. Okay? So ayan yun siya. That is basically your stress incontinence. Ano pa? Anything that will give pressure to your abdomen. Okay? Mag-utong ka, okay, night times nga kanabit nang mag-utot ka, pag utot nimo apil pod gawas imong ihi. That is still stress incontinence. Ano pa? Pagdala ninyo or if you're going to carry heavy objects. Okay? Because if you're going to lift, you're going to do Valsalva maneuver man. Di ba? Muutong man ka na. That's what Valsalva maneuver is. Pag utong nimo, pag-carry mo, wala ni gawas ang ihi. Ayan. And it is somehow degrading that feeling. No? Ulaw bitaw kaayo po. Okay? You also have there your urge incontinence. I will be showing you a video or not video, a picture of this mamaya. Okay? Inability to urinate. So magkakaroon ng urinary retention. So in your assessment during palpation on your lower part of your abdomen, magkakaroon ng distension. So distended abdomen. Okay? Ayan. Underactive bladder, bladder is unable to send signal when full. Kaya sige lang yan sa ihi, ihi, ihi. It is somehow related to your overactive bladder. Uy, ay, hindi pala, I'm sorry. Underactive bladder is unable to signal when full. So ayan, dito pala yan siya. Sorry. Ayan. Okay? Magkakaroon ng urinary retention. Okay? Ayan. So this is now your types of incontinence. You have there your overflow. So nagkakaroon ng urethral blockage, the bladder unable to properly empty kasi constricted. All the time constricted yung inyong urethra or maybe meron yung siyang ano tawag ito, obstruction doon. Okay? Stress incontinence, nasabi ko na ito. For your urge incontinence, bladder is oversensitive from infection. So the etiology of your ano tawag ito, urge incontinence, one of the etiology is from your infection. So or your neurologic disorders. Okay? So nagkakaroon ng leaking. Okay? Kuha natin dyan. Yan. So you have here two types of your neurogenic bladder. You have there your spastic and your flaccid. Okay? Pag sinasabi natin spastic, you have to remember this one para hindi kayo malito. Spastic, sensation, and motor control ang nawawala. Okay? Nawawala yan sila. Okay? For your flaccid, that is just basically loss of sensation. Okay? So it continues to feel, balik tayo sa spastic, no? A bladder empties on reflex and there is no control. Here naman, continues to feel undistended, pooling of urine doon sa inyong urinary bladder. And of course, nagkakaroon ng incomplete emptying. Okay? Kasi nawawalan din tayo ng loss of sensation. Okay? Wherein, full na pala yung bladder mo. Okay? Ayan. So types of neurogenic bladder. Spastic, sensory, and voluntary control of urination is disrupted, partially or totally. The stimuli generated by bladder filling cause frequent spontaneous detrusor muscle contraction. Kaya yan siya contract. That is why it's called spastic. Okay? Nagkakaroon ng spasms. Okay? And involuntary emptying caused by disruption of your CNS, transmission above the sacral spinal nerve or spinal cord segment. So the cause of this one, you have there your SCI, or your spinal cord injury. And whenever we're talking about SCI, you will be learning this one in your neuro concept next semester. Pag sinasabi natin SCI, always remember that it is reversible dyan. Irreversible damage. Okay? You will not, if ever you will be having SCI or spinal cord injury anywhere doon sa ating cervical, sa ating thoracic, sa ating lumbar, or even your sacral and your coccyx, sa spinal nerve natin, you will have paralysis. No? The organ that will be paralyzed, okay, depends on the spinal nerve that is damaged. Kung doon sa cervical, kung sa cervical class, luoy ka ay mo na class, C1 to C2 or C3, you will be left paralyzed, no? Upper and lower extremities mo. You have there what we call your quadriplegia or quadriplegic yung patient natin. Okay? Ayan. Though there will be some through rehab, manggod, there will be at times wherein ma-regain mo yung iyong movement but it will not go back to 100%. Okay, just like with my I don't have any kasi akala nila noon there is neuropathy in my leg, my lower extremities, but when they check during the I forgot the term, no? Wherein needles are inserted doon sa aking lower extremities and then they will try to check for the impulse transmission. Walang problema sa impulse transmission. So that means that my nerves are doing fine. It's just that yung muscles ko, they do not contract. Remember, the one responsible for the contraction or movement is of course your muscles. The one controlling, okay, the movement of your muscles is of course your CNS or of course your nervous system. Okay, so nagkakaroon ako ng myopathy. No, it's not neuropathy. Dito, class, sa neurogenic bladder ninyo, neuropathy yan. Meron tayong problema sa ating nerves. Kuha natin, myo means muscle. O, ito. Okay? So you also have there your stroke. Yes, multiple sclerosis. Sir, ano ba yung MS natin? It is also called your MS or your multiple sclerosis. Problema, if you could still remember, no, if this is your neuron, okay, you have there your dendrites. So body mo yan. And this is basically your axon terminal, back. Okay? Diba dito sa ating axon, meron tayong mga ganito. This is what we call your myelin sheath. No? Okay? Ito yung mga Schwann cells natin that produces your Schwann cells that produces your myelin sheath. Now, ang problema dito, class, if there is demyelination, okay, this is basically the effect of your multiple sclerosis kasi ito yung autoimmune disorder wherein yung immune system mo kakainin itong ating Schwann cells or itong ating myelin sheath. Now, remember the function of your myelin sheath is that it hastens or it quickens the transmission of your impulses. Okay? So, isipin mo, logically speaking, if wala kang myelin sheath or if damage yung myelin sheath mo, mahina ang pagpasok or pagpass ng inyong impulses. Impulse transmission will be decreased. Kuha natin. And of course, you have there your CNS lesions or your lesions. Okay? It will affect kasi if ever yung lesions natin andun sa brain and then somehow yung lesions natin is located dool sa imong pons. Okay? So, maapektuhan yung pons mo. Okay? Causes of flaccid or flaccid neurogenic bladder, still spinal shock, myelomeningocele or your meningocele. Ito yung ating congenital anomaly class, no? Congenital anomaly, meaning there are babies anomaly. Ambot na kung double L na siya. Anyways, congenital anomaly. Ano ba ito? Problema already. Once the baby is out, ando na yung problema. Okay? So when we say meningocele, okay, an effect of your meningocele is that there is ano tawag ito? Yung development ng inyong neural tube, because your neural tube, kung hindi pa develop yung brain and spinal cord mo, kung ikaw ay isang fetus pa lang, that's what we call your neural tube. Okay? Your meningocele, this is basically a neural tube defect. Okay? Pag sinasabi natin neural tube defect, that means that if you are just normal, yung neural tube mo will develop into your brain and your spinal cord. That is why dapat, if ever you become a father already or a mother, make sure na magpo-prenatal kayo to check if you have normal levels of, let's say, for example, folate, no? Yung ating folic sa ating katawan or folate sa ating katawan. If ever mababa yung folate natin, you will be given folic acid. Okay? Kasi that folic, okay, yung folic natin will help in the development of your neural tube. Yung ating myelomeningocele and your meningocele, these are what we call your neural tube defects already. So wala na kompleto ang pag-develop or pag-mature sa imong spinal cord. Okay, this is an example of your anong tawag dito, meningocele and your myelomeningocele in your spina bifida. Okay? No? Uy, spina bifida, sa ganito. It sounds familiar. It is in your pedia na rotation or na concept ninyo. Okay, so there is no complete fusion of your spinal cord. Okay, kuha natin. Ayan. You also have there your peripheral neuropathies. These are one of the common complications of your DM or your diabetes mellitus. Okay, kasi how do you call this? Nagkakaroon ng hypoxia already. Okay, pag sinasabi natin peripheral neuropathies, meron din tayong nephropathy, ayan, micro neuropathies as well. Sinabi ko na, multiple sclerosis, chronic alcoholism, and prolonged overdistension of your bladder. As much as possible, class, no, kung if ever you will be having duty already in the ward, dapat mangihi mo dayon na if you feel the urgency to take a bladder break. Pero kung may times naman na kinakaya natin, okay, the only take away from that one or the only thing that is advantageous, no, while doing this, naghang akong nahong. By doing this is mas mahirap tayo magkaroon ng incontinence, no, mas malakas yung control natin sa ating urinary sphincter. So we will not have any problems. Lesser yung risk natin, no, to develop that incontinence na yun. Okay? And diagnostic examinations, you have your urine culture. Okay, if ever, bakit may urine culture? To check if it is infection yung ating cause. Okay, urinalysis as well. Okay, CREA and BUN, baka pala meron na tayong decrease or meron tayong renal insufficiency or renal failure. Okay, post-void bladder scan, cystometography, and of course your cystoscopy. Okay, ayan, so this is your cystoscopy. Ito yung ating mga BUN and CREA, no, to check for the functioning. You have there your urinalysis as well. Ayan, and your cystometography, no, to check. Ayan, parang I think this is somehow ang ginagamit nila dito is your ultrasound din ultrasound or yun nga, ultrasound na device or maybe pwede rin yung ating Doppler, okay, to check, no, dito yung sa ating lower abdomen. Okay, ayan, if ever merong mga obstructions dyan, if ever there are any enlargement, no, of your organ, no, doon sa ating urinary system. Medical management of your neurogenic bladder, the goal there is to maintain continence kasi nagkakaroon tayo ng incontinence and avoid complication associated with overfilling or incomplete emptying of the bladder. Sir, tanong ano ba yung mga complications when overfilling? Guys, remember, meron tayong mga reflux dyan. Okay? If ever there is overfilling or incomplete emptying, no, it increases the chance of urinary tract infection. It also increases, kasi meron tayong stasis So kung may stasis dyan, isipin nyo na lang, no, the things that I have been teaching you. Pag may stasis sa urine, of course, it will increase the risk of having stones as well. Aside from that one, yung UTI natin, and of course, those two, infection and that disease, yung stone forming, yung calculi natin, would lead to your renal failure. So ayaw natin yung mangyari sa ating pasyente. Thus, teaching is primary intervention. You have the medication, the nutrition, bladder retraining, and of course, catheterization. Saan ano ba yung bladder training? Ito na experience ko talaga ito siya. Since ako yung patient talaga, no? My catheter was due to be removed already. Siguro second to the last day of my admission. My stay in the hospital. Lipad yun kayo ko, yes. Pero, nasuya ako kay wala gitanggal dayon and then gi-explain ako, sir, before nato ni tanggalon, sir, mag-bladder training sa kanamo, sir, ha. So you just the aide there told me the instruction na ina lang ko, so igina-clamp yan siya So what you're going to do with the tube sa inyong urinary catheter or sa inyong Foley catheter is that you're going to clamp that one. Okay, maybe using sa atin. Meron sa third world or not third world, so developed countries, they have their clamp talaga. Sa atin naman, what we do is that we're going to use a how do you call this? Plaster. Let's say for example, kung ito yung tube natin, okay? Not the IVF, ha, ito yung ating tube. You're going to clamp that one here. Okay? Tapos you're going to wrap it with your anong tawag ito, plaster. Okay? Para ma-feel mo yung urgency to void, no? Yung feeling of the bladder. Okay? Sabi niya, sir, inalang ko kung you feel tawagi lang, no? Just press that button. Okay? Para ma-informing gusto ning mangihi. So there that's bladder training. So pagka iuna ko, unclamp lang na nila or uncoil, at ma-feel ko talaga. No? Yung reflux, even the reflux itself, na-feel na ako. Sana all yun ang sabi, no? My feelings. Okay, so yun ang nangyari. That's what we call your bladder training. Okay, and of course, your catheterization. Okay. For the surgical management, for your medication pwede dyan, yung mga ating antibiotics, if ever it is caused by your, anong tawag nito? If ever it is caused by your infection, okay, by your bacteria. Okay? Yan. And you also have there yung mga antispasmodic natin din. Okay? And this is your surgical management. You have there your rhizotomy, destruction of the nerve supply to the detrusor muscle or external sphincter for patients with hyperreflexia or spasticity. Sir, ano bang nangyayari dyan? It is a minimal invasive procedure. Now, they're just going to insert parang a needle. Ito yung picture, okay? Needle there, and then they're going to destroy yung ating mga nerve roots dyan. Okay? This will help in the overactiveness of your urinary bladder. Okay? Ayan. For the urinary diversion, it is a surgical management. From the word itself palang, urinary diversion, they're going to create another pathway for your urine that is connected to your urinary bladder. Okay, because remember that your urinary bladder is the one that stores your formed urine. And the one that is forming your urine is, of course, your kidneys. Okay? So dito, para yan siyang tinatawag na bypass. Guys, ay kalibog. When we say bypass, they're going to create another pathway for that one. Bypass na two words, okay, that means that there will be a passage doon pa rin. Okay, you're not creating another, anong tawag ito? Pathway for that one. Okay, ayun na yung kalibog. Bypass and bypass. Bypass na one word. This is one word, ha? And this is two words. Yan. Or meron tayong tinatawag na implantation of artificial sphincter. Dili bladder, ha? Sphincter. Now this one, kasi meron tayong mga clients, no, na ulaw manggod. I mean, come to think of it, makita kag someone who urinates, no, uncontrollably in the public, of course, that patient or that client is subjected to shame. Napad yung uban nga, grabe pa yung mambuli, lami kayo ikuan, si tawag, ano, barangon. mga bad. No? Just be kind lang talaga, class. No? Ayan. So what they do is that they're going to create an artificial sphincter, no, para i-contract yung ating urethra. Not basically not doon banda sa inyong urinary bladder. I'll be showing you pictures. So this is rhizotomy. This is now your urinary diversion, as you can see, no. How do you call this? Pwede siya magkaroon, you have here your ureter, kidney ureter, and this will now act as your bladder, urinary bladder. Okay, so magkakaroon ng stoma. Okay, urostomy, opening. That is what we call your urostomy, the stoma. And this is your ileal conduit. Okay, so I think they're going to resect a part na doon sa inyong anong tawag nito? Sa inyong small intestine, no, ileal, no, ileum natin. DJI man, diba? Duodenum, jejunum, and then your ileum. I think they're going to get a part from your ileum, and then they will make that one as your urinary diversion already. Okay? Palabas sa inyong skin. That is basically your urinary diversion. Okay? Nursing management. Wala dito yung picture ng kuan. Sandali lang. For the picture, so ito ang picture kong kuhaan. Artificial sphincter. Ayan, images. Ano bang itsura ng artificial sphincter natin? Ganito. Okay, ito yung dapat. Okay. Open image. Mutab yan. Ganun. So, ayan. So this is basically your artificial sphincter. Ito dito, your urethral cuff. This is now the pump. Okay, we're in. Pag i-pump mo yan siya, of course, sir, bakit may balloon? Nagalupad ang balloon. Sorry. Wala, so ay, ako ra isa, bahala mo dira. Okay, so this is your balloon here. This is for your anchoring. No? Anchor na siya. No? Dili na siya kay nagalupad para, no? Oh my God. Dili man po siguro makauna-unaan, no? So this is for your anchoring para it will just stay in place yung ating artificial device. And this is now the cuff being placed na doon sa ating urethra. Okay, remember this is your urethra, this is your bladder. No, I'm sorry. This is your bladder. Prostate din siya. Prostate. Ano yung prostate nimo? Okay. Ayan. Unsa man yung isa ka kuan diri, sir? Kana siya, mo na siyang gikan sa imong itlog, sa imong testis. Okay, ana. Okay. Ano tawag ito? This is now your urethral cuff. If you're going to pump that one, that means that it will keep your urethra contracted. Okay, hindi yan siya, you will not, this is to prevent any leakage, any, ano tawag ito, any shameful or embarrassing leaking of your urine. Ayan, kuha natin. Sige. Okay, next is, of course, nursing management natin promote urinary drainage and continence. So nagkakaroon tayo ng bladder training, prevent complication. So you have to administer or make sure that the client has a specific diet. So sa nutritionist natin, refer, okay? Medications as well, teach patient and family self-care techniques, sugar points to stimulate voiding, and then self-catheterization. Meron, yes. Meron tayong self-catheterization already. And then most of the time, ang lisod aning self-catheterization class, no, is, of course, if ever you are, meron kang problema sa CNS mo already. Let's say, for example, you experience stroke. Okay, unya, ang imong gigamit na urinary catheter or Foley catheter is lahi siya nga material. It is your latex. Okay. Meron kasing silicone din eh. Yung silicone, months talaga yun. Months talaga yung pwede i-retain doon. If your silicone, some of them are using it as a silicone. That means that prolonged yung stay ng catheter doon. So 9 times nga mag-stick dyan na siya. Mag-stick na sa imuhang bladder. It was very hard for us to remove talaga the bladder. We were like working as PDNs before. So ako, not me. Ito akong kauban. So ako mag-uban naman ko ana, no? Mag-join, flower, baboy. Ayun, so nighttime nga we had to remove the catheter and place another one. Pilit jud siya. Okay, so we called the doctor and just the doctor just said na i-twist nila talaga. Doc, we were twisting it already pero ayaw pa rin matanggal. Mahirap. Pero sige lang. Persistency is the key. Be persistent lang, natanggal man po siya. No, na-withdraw na namo. Sir, basig wala na nyo gikuan. Gitanggal tong tubig. Okay, we removed, no, the sterile water or the NSS, that the one that inflated the balloon. No? Sigurado yun na mo. Wala na may ma-withdraw. So ayun, yun ang problema, no, sa ating mga urinary catheter. That's why they are prone to infection as well. Nursing diagnosis natin, impaired urinary elimination related to impaired bladder innervation. Kaya nga, kasi nga meron tayong problema sa ating pons, or maybe aside sa CNS natin, meron din tayong CNS, yes. Actually, it is the CNS and the PNS. Okay. Toileting self-care deficit related to neurologic injury, risk for impaired skin integrity related to urinary incontinence, and risk for infection related to impaired urinary reflex. Ayan. Uy. Pumanata sa isa. Okay, so I'll be taking a short break muna. Okay, so let's talk about your last topic for today. It is your renal obstructive. Share ko muna to. Yan. Okay, for your renal obstructive conditions affecting your fluids and electrolyte balance, bakit ba ito ating renal calculi? Renal calculi. This is your nephrolithiasis. Okay? Ayan, same na siya. Nephrolithiasis is basically crystalline structures that form from the components of your urine. Pwede ba dito? I think so. Okay, so you have here the kidney stones in the minor and major calyces. So the kidney, yung mga pyramids natin, renal calyces. Okay, dira na siya. Kidney stone in the ureter as well. We have here an example wherein there is urether. No, may makikita ninyo, no? Okay. Yung sa ureter, anong tawag doon na lithiasis. Okay. So the etiologic factors, you have there the diet. Okay. There are times wherein pag mataas masyado yung protein natin, kung if we're eating a lot of proteins, especially animal proteins, okay, animal proteins, yung mga red meats natin, because that would mean that it is high in purine, no? Yung ating mga red meats that would lead to your uric acid, and then it would develop into your urate crystals, no? Ito yung complications ng ating gouty arthritis as well, no? Pag mataas masyado yung uric acid natin. So purine, mataas yung purine natin, calcium as well, okay? It is also caused by your infection, such as your staphylococcus and your Proteus mirabilis. Okay, yung P. mirabilis ninyo, and you also have your Klebsiella and yung ating streptococcus as well, no? This will make your urine alkaline. When we say it will make your urine alkaline, yung pH ng ating urine ay tataas. And remember that when we're talking about the pH, may it be urine, gastric pH natin, skin pH natin, pag mataas yan siya, alkaline yan siya. Because by default, your urine is acidic in nature. Kumakain ka ng ganito. Or you have this UTI or urinary tract infection that is caused by your staph and your Proteus mirabilis. So yun, tumataas yung ating alkaline. That is why meron ka makikita mamaya sa ating slide na yung diet nila, acid ash diet, to flush these bacteria away, thus decreasing ang result ng acid ash niyo is that it would decrease now your pH, making it acidic. Okay? Dehydration as well, that means that, yes, dehydration, no? Kung kain ka ng kain tapos there will be oversaturation. Okay, meron tayong tinatawag na oversaturation, that means that mas mataas yung solute contents, concentrated talaga yung ating solute contents compared to your solvent. Okay, or yung fluids natin. Wrong use of certain drugs. Ano ba yung mga drugs na yan, sir? Meron tayong vitamin C. Oh, vitamin C? Yes, vitamin C. Bakit? Guys, ang pinaka safest, no? Safest na highest dose for you per day is 200 2,000 milligrams. So that's like 2 grams, no? Pero merong iba 45 to 75, depending lang din sa case ni mo sa imong condition, because there are times when makamataas na masyado yung 2,000 milligrams or 2 grams ninyo per day, no, that would lead to stone formation, no, yung vitamin C natin. You also have their urinary stasis. Okay, urinary stasis would lead to yung ating UTI, and that would lead to making these bacteria would make your urine pH high, and that would increase the risk of having stones then. Location of the stones, urolithiasis, stone anywhere in the urinary tract, that's urolithiasis. Nephrolithiasis, it is in the kidney stones, and then ureterolithiasis, it is in the ureter. Okay, again, everybody say ureterolithiasis. No? Hindi na siya lithiasis, lithiasis, no? Nephrolithiasis. Para mas maganda. So this is an image, no? I think this is an X-ray, no? X-ray image na doon. So these are the stones sa inyong calyces. There are times wherein makikita mo talaga triangle sila or pyramid shape sila kasi nga it's taking the form of your renal calyces already. Ito yung sa mga anong tawag ito, sa mga staghorn or struvite, no? Staghorn calculi. Okay? Which is the largest, no, if I'm not mistaken. So there's oversaturation or supersaturation. Yung mga theories, no? That means that mas mataas yung solutes natin sa ating katawan compared to your solvent or your fluids. Okay, kaya nga dapat para to prevent the formation of stones, no, dapat at least 8 glasses or ilan ba liters, 2 to 3 liters per day, no? Kung ating increase OFI, dapat talaga tayo dyan, class. Okay? Your urinary pH, pag ang urinary pH natin ay hindi pala mababa, mataas dapat. Mataas ang ating urinary pH, that means that it is alkaline. Okay? Ayan. And then matrix, organic materials arising from the tubular epithelial cells acting as a nidus of stone formation. So meron tayong mga promoters tayo dito. So they promote in the formation, it contributes to the formation of your stones. So inhibitory theory, you also have there your nephrocalcin. This inhibit your calcium oxalate. No, sorry, ayan, calcium oxalate yan siya because this is one type of your stone. Pag sinasabi natin nephrocalcin, this is the one responsible for inhibiting your calcium oxalate because your calcium oxalate, pag meron yan siyang built up, it will form now your crystal that will lead to your nephrolithiasis or stones in your kidneys or stones in your urinary tract or your urolithiasis. Now, pag ito mababa, that means that wala masyadong nag-i-inhibit ng calcium oxalate formation ninyo. Okay, wala masyadong nagbe-breakdown or nag-i-inhibit. Okay, that's why it would now increase the chances of having renal stone. So deficiency of proteins that inhibit stone formation. These are the proteins that are formed by the renal cells. Example, your A. Nalas ng E. Ang ona na ino. May ino. Namamang ako ng sorry. No. We should not be doing that one. Sorry, my bad, Lord, my bad. You also have there tam horsefall, mucoprotein, little effect on crystal aggregation. And lastly, you have there your uropontin inhibit calcium oxalate as well, together with your nephrocalcin. So kung ito sila, kung deficient ka nito, of course, it will now increase the risk of you having your stone formation. Types of stones, yung sabi ko sa inyo kanina, your calcium stone. This is the most common among the 4 stones na andito. Okay, next is you have your struvite or staghorn, no? Bakit siya tinatawag na staghorn? Because if you will notice yung mga horns ng stag, not really staghorn, basta it is describing, no? It looks like the staghorn. Yan. So you have there, ano ba ang content nito? It is made up of your magnesium ammonium phosphate. And this one, itong formation na ito, if there will be buildup of this one, it is caused by your Proteus mirabilis. Okay? Yung P. mirabilis ninyo, this releases enzyme, which is your urease, that would lead to the formation of this one. Kuha natin. Yan. Tayo dito meron tayong calcium phosphate and calcium oxalate. Okay, next is yung staghorn natin, which is yung magnesium ammonium phosphate natin. Third is your uric acid. Sir, uric acid, purine, high purine in the diet. Ang sama ng mga purine. Guys, mga purine natin, mga organ meats, red meats natin, pwede din mga seafoods natin, yung kanang sa pasayan, okay, kanang crabs. Yes, it does. No, mauna naga-trigger sa ako ang gouty arthritis. No, wherein mayroon ka mga tophi dyan. That is why one of the complications of your gouty arthritis is your kidney stones or your nephrolithiasis, specifically your uric acid stones natin. Okay. Lastly, this is your cystine. It is rare and it results from a genetic defect tayo dyan. So for your calcium and phosphate oxalate stones, ito yung mukha nila. Ooh, diba? Just remember this one. Just think of having these stones doon sa ating anong tawag ito, sa atong kidneys. That's the reason why, class, or in the urinary tract, meron tayong pain talaga, no? Pain talaga, masakit talaga, no? Loin flank pain, meron din tayong tinatawag na renal colic. Okay? That means sa may lumbar lumbar area banda, masakit, no? And then if you're going to do a kidney punch during assessment, yung ganito na pagpalpate ninyo or percuss, ganito yung pagpercuss, bang, masakit yan. You will now elicit tenderness. Cystine and xanthin, ito, parang yung tinitira ko. I'm just, parang, oh, diba? This is like a penny, and this is how big your stones get. Pero antayin niyo yung sa staghorn, class. Antayin niyo yun. Sobrang laki nun. So this is your cystine and xanthin. This is now your uric acid stones as well. O, di ba? Ang lalaki. Mas yung staghorn natin. I will be showing you that one later ng staghorn. So tingin ko manifestations talaga merong pain. Pero sir, bakit meron akong nababasa na the pain is asymptomatic, hindi nila na-feel, no? Meron yan because the reason why meron tayong pain is that there is a dilatation, no, of your ureter or of your kidney. No, makikita nyo din yung na term mamaya, no, magkakaroon ng dilatation. If there's no dilatation naman, asymptomatic yung ating patient. No, they rarely feel the pain or the loin flank pain natin. So depend on the size and location of the stone, magkakaroon ng kanang abdominal, flank pain. You also have there your groin pain. Okay, again, depending kung saan yung site. Ito yung sinasabi ko. Staghorn calculi, it is asymptomatic. The reason for this one is that, nasa mo yun dito? Pero yun dito eh. Meron nagkakaroon ng dilatation eh. So you also have there your hydronephrosis kasi nga because there is already obstruction. So magkakaroon ng backflow doon ng urine. So magkakaroon ng stasis yun. Manong buburot. Hydro means there's water inside your kidneys. Hydronephrosis. Nagre-reflux doon eh. Okay, that's why it is building up. As you can see, tanawa so nakadako na nakaroon. Okay, compared to your other kidney that does not have any obstruction. Okay, so you have their fever chills pyuria because this one indicates infection. Nausea and vomiting because it now attracts, or it is now your vomiting center is now triggered. Okay, and cool moist skin as well. Diagnostic examination, you have there your UA or urinalysis, X-ray, IVP or your intravenous pyelogram. Na-discuss natin ito siya ha. Yung IVP natin, it uses a contrast medium which is your iodine. Okay, kaya health teaching natin or suggestion natin, or not really suggestion, we have to really take into consideration na, or ask the patient na, uy, meron ka bang, not really, uy, no, sir or ma'am, meron ka bang, are you allergic with the seafoods? Not really with the iodine kasi basig na yung uban nga, wa sila kabalo, sila iodine. Okay, seafoods tayo dyan. Okay, you also have the ultrasound, usually of the KUB, bus para ma-check no, kung saan doon banda. Okay, your ureter and your bladder. Okay, so dito sa KUB natin, ano yung dapat? Full bladder tayo dyan. Okay, and of course, you also have there's another imaging study, which is your CT scan. Phases of your stone management, acute phase, of course, narcotics for the pain, antispasmodic para hindi sige contract yung ating urinary tract. Okay, anti-emetic as well for the nausea and vomiting, for hyperemesis, warm bath to relieve flank pain. Okay, ayan. Elimination of stone. So in the elimination of stone, management tayo class, management tayo. Isipin natin management ito. Waiting to be passed out, elimination of stone via the normal way wherein nag-ihi ka. Class, one thing you have to remember as well, pag if we're talking about nursing responsibilities, if we're talking about anong tawag ito, clients with renal failure or non-renal failure, renal calculi, okay? Kaka-admit lang, okay? Strain the urine. Saluron ninyo ang urine. Using what? The hands. No, not the hands, okay? You're going to instruct the patient, no? Sir, ibutang nato ni diri sa botilya or any kung sa urinal, meron man siya provide urinal or doon sa ating bedpan. Okay, saluro na ninyo dito. And then after that one, you're going to strain that one sa filter ba, i-filter nato na siya, no? I-strain nato na siya. Kanang ito ginagamit nato kanang magluto tag pansit canton, gina-strain man nato ng pansit canton dito. Sir, bakit natin to ginagawa? Because this is now to check for the stones that passes through your urine. Okay? This is the elimination of stone through the or via your urine. Kasi bakit? Once you have strained the stone, you can send it to the lab to identify kung anong type siya ng aray, ang sakit. Anong type siya ng stone. So that there is a prompt medication or prompt management for different types of stones. You will learn kung ano yung diet ng dumudugo. Kung ano yung diet na kanilang i-avoid. Okay? Mechanical intervention, this is basically non-invasive use of machines natin. Kaya nga tinatawag mechanical. Lithotripsy. This is an example. Lithotripsy wherein there's like shockwave. No? Meron yan siya. There are times wherein by the way, there are multiple types of your lithotripsy. Some of the types there are mechanical interventions, or they are non-invasive. So they will be sending shock waves, high frequency of shock waves. Okay, it will not actually harm the body. It will actually shatter yung mga stones natin into smaller pieces so that it can be urinated. Okay, meron tayong ESWL. I will be showing you that one or discussing that one later. Okay. So, muna siya lithotripsy and of course, surgical intervention, no? Opening already, no? Para kunin yung inyong stones. Okay? And lastly, long-term prevention of recurrence, increase OFI talaga tayo dyan, 3 to 4 liters per day, diet and medication. Diet modification and mga maintenance drugs natin dyan. Okay? Goal is to decrease the concentration of substances. Pharmacologic, you have your potassium citrate therapy. It attaches to calcium in the urine, preventing the formation of your mineral crystals, okay, such as your calcium oxalate or yung anyong calcium phosphate. Okay? No, wait lang. Calcium phosphate. Calcium. Phosphate lagi. Phosphate and your oxalate. Okay. Ayun. Next is your thiazide. This now increases the urinary calcium excretion. Pag meron tayong hyperkalemia, if you have hyperkalemia, this might increase the chances of developing your calcium stones, calcium oxalate stones. Okay, allopurinol din. Oy, sir, unsa man ang allopurinol? Para mana sa imong uric acid. This prevents the formation of uric acid nidus or nidus. Okay? Ito din yung aming ginatake. Amin? Yes. Ginatake na ko na siya for my gouty arthritis no, before allopurinol. Ngayon, I just take colchicine and my celecoxib no, for pain. Ayan. Allopurinol, this is basically for decreasing your, this is your uricosuric. Okay, uricosuric na siya. Okay, ginapababa na yung uric acid. For small stones, alpha blockers or for small stones, alpha blockers or adrenergic antagonists, it relaxes muscle tension in the ureter to facilitate the passage. Okay, example of this one is your tamsulosin, sodium bicarbonate as well, and your pain relievers. Okay, for your sodium bicarbonate, it also inhibits not the growth of your or the collection or the buildup of your stones. Okay, for your sodium bicarbonate, especially those stones that how do you call this? That is acidic in nature. Sodium bicarbonate para kasi meron tayong mga stones wherein pag acidic masyado yung nature ng ating urine, that would basically or within our body, that would basically increase the chances of forming a stone. Okay, so sodium bicarbonate tayo dyan. And dietary management natin, calcium stones. For the calcium stones, limit milk and dairy products. But when we say limitahan lang, pwede pa rin yan sila makainom. Because if ever, this is the misconception kasi, if patients have calcium stones, they think that they should not be taking calcium anymore, but your body needs calcium. Okay, pero limit lang natin yan siya. Okay, you can still eat or take yung mga calcium supplements or yung mga foods rich in calcium, but limit lang natin dyan. Provide acid ash diet to acidify urine, such as your cranberry. Ito yung pinaka-famous natin, prune juice, meat, egg, poultry, fish, grapes, and of course whole grains, and of course take vitamin C to increase your immune system. To boost your immune system. Pero again, guys, yung vitamin C natin, it also increases the risk of stone formation ba yan? Okay, so ayaw kayo pasobra ha? Ayun na yung ilaklak nga. Do not take it overzealously kung if ever there's a word. Okay? Oxalate stones, so be careful of taking vitamin C. Oxalate stones naman, avoid tea, chocolate, rhubarb, spinach. Aside from this one, merong mga nuts din, yung mga nuts natin. Mga peanuts, nuts, ha? Maintain alkaline ash diet to alkalinize the urine. Okay, and then milk, vegetables, fruits except prunes, cranberry, and plum. Kasi itong mga prunes natin, yung mga citrus natin, mga citrus fruits natin, hindi siya maka-maintain ng alkaline ash. Ito siya, doon yan siya sa calcium. Okay, doon siya sa taas. You're trying to make your urine acidic in nature. Ito naman dito sa oxalate stones natin, you're trying to make an alkaline stone. Alkaline pH, I'm sorry. Reduce foods high in purine for the uric acid. Oh, ito. High in purine, liver, brain, kidneys, sa bulalo ninyo, kanang bone marrow ninyo, apil na siya, kidneys, venison. So man ang venison, kanang meat ragyapo na siya. It's red. Red meat ragyapo na. Shellfish, meat soup, gravies, legumes. No, kanang gravies nato na magud na siya yung mga liver po dira, nga liver extract. Ano say liver extract sir kanang gi-grind ba? liver spread na to. Okay, aside from this one, organ meats, no, in general, organ meats, isaw kana jud. Okay, unsa pa? Sardinas. Okay. Oh, ginaisip ko na lang yung aking mga bawal sa akin, sardines. Meron din tayong mga tuna. Okay, yung mga tuna natin, it also increases the risk of mataas yung purine nila. Okay? Ayan, surgical management, you have there your left nephrolithotomy and your ureterolithotomy. Indications, presence of infection, progressive renal damage and obstruction to urine flow, and of course, for severe pain as well. So nephrolithotomy, okay? Tinatanggal yan siya. Non-surgical management naman, you have there your cytoscopy, remove a small stone in the bladder and the ureter, and of course, your ureteroscopic stone removal. Insert a scope to fish out broken stones with a laser. Because merong times class na yung ating laser treatment, I think this is better kasi mas pino yung ating lithotripsy pa rin siya using your laser beam. Okay? So yung lithotripsy natin na laser, kasi maraming siyang types yung laser natin, it will mas pino yung kanyang pag-breakdown ng inyong stones. Mas madali siyang ma-excrete. Kasi yung sa ating ESWL, no, I will tell you kung sa meaning ana, the L is lithotripsy pa rin. Laser siya, taas magod siya. Ang problema nito is that, yes, it can shatter. It can shatter via your shockwave. It will shatter your stones. Pero may times na dagko gihapon where it can become as an obstruction sa inyong urinary tract. Okay? Ayan. Third one is your lithotripsy, a process of eliminating a calculus in the renal pelvis, ureter, bladder, and gallbladder. Crushing the stone in two methods. You have there the shock wave or high energy, yung mga beams natin, yung high energy na yun. Okay? So types of lithotripsy, ito yung ESWL na sinasabi ko. This is a non-invasive ultrasound. Sandali lang ha. Let me just check first kung ano meaning ng ESWL. So for your ESWL, it is what we call your extracorporeal shock wave lithotripsy. Extracorporeal. Okay? Ano meaning ana sir? Ito. So ito yung ninyong, this is basically the ano tawag ito? Yan siya yung inyong meaning ng ESWL natin. Okay? So going back, another type of your lithotripsy, ito yung laser wavelength and dye interaction. And next is your electrohydraulic probe inserted to the location of the calculated and drain fragments with NSS or irrigation forceps. Okay? So dito ra gyapon siya if ever there will be something na i-insert na, they will be using the urethral or your urinary orifice, doon nila i-insert yan. Of course, you will be under the anesthesia. Effects of anesthesia dyan. Okay, general anesthesia. Percutaneous naman, invasive ultrasonic probe into the pelvis to fragment large stones, incision at the back, then scope is inserted to remove the stone after fragmentation. So meron yan silang, I will be showing you a video mamaya, no? Kung paano yung basket na, meron yung term I think it is here, yung complication nito. Ultrasound, so for your ESWL, kidney stone, less than 20 millimeter, and urethral stone, less than 10 millimeters. Okay? Sir, bakit mas malaki sa kidney stones natin? Of course, mas malaki yung space doon. Most of the time sa ureteral natin, mga saag lang man dira, no? Kana mga gagmay nga stones mo adto dito. So ultrasound delivered shock waves. Okay? So extra corporeal so to shockwave lithotripsy. Okay, ESWL, but same thing, lithotripsy, shockwave tayo dyan. And beam lang yung dalawa. So applied externally while client is submerged in warm bath or lying on a lithotriptor. Okay, it's like a bed. Okay, with the back supported by the water-filled coupling device placed at the level of the kidneys. So ito yun siya. This is now the water deploy. Ito yung support. Okay, so you have here yung ating ESWL para mag-shockwave dyan. Ito yung reflector. Okay, para magbalik-balik na siya. Okay, ito yung another bed, yung sabi ko, ito yung bed na ginahigaan. So this one is with water at yung walang water. Okay. Client receives anesthesia, whether it's conscious, sedation, or spinal, or general, to facilitate lying very still. Hindi naman siya invasive eh. But we want the patient to be relaxed and at the same time to alleviate the anxiety and at the same time para stable talaga siya. I mean, fixed talaga. No, hindi masyado siya magalaw-galaw because that would somehow decrease the accuracy of your lithotripsy manggod. Okay? Urine strain after and then monitor for hematuria. Kasi, guys, where are you going to monitor hematuria? Because, sana ba yun? Sana lang ha? Ito. Because of your stain straws. No? Stain straws. No? Multiple stone fragments block the ureter, forming a stone street. No? So that's the reason why you're going to monitor for hematuria or even gross, yung microscopic natin and even your gross hematuria natin. Kuha natin. Ayan, kasi may times wherein, yes, gina break down na yung malaki na stones into smaller pieces, but there are smaller pieces that might block, the pathway, your urine doon sa ating urinary tract. Okay, maggasgas na siya and then magdugo, and then that's why there is still painful urination. Okay, i-check mo din yan siya. Stent may be inserted to facilitate passage of stone fragments. Okay, related stone fragments, you have there, you're related to complications of, ito yung mga complications na yun. Okay, related to stone fragments, you have there your renal colic. Kasi meron tayong colicky pain doon sa ating abdomen. Let's just try to be more specific. So you have there your renal colic. Okay, incomplete fragment then. That means that wala kayo siya na nabungkag. Okay, fragmentation or fragmented means nabungkag, pieces to pieces or pieces by pieces yan siya. And also have there your strain straws. This is the multiple stone fragments. Okay, this now would block the ureter, forming a stone street. This is still related to your shock wave. So unsa ba na siya? Okay, muna siya ang wait lang. Mawawala muna ako. Optimize ko muna ito ha. Ayan. So this is what happens with your stain straws. Our stain straws ay ganito. You have here the urinary system. Ito isang bato, stone. After the ESWL, ayan, yung street na nangyayari. A street of stones that would cause the blockage. Oh, street stones, di ba? And that is your ureter. Anong gagawin dito? You're going to insert a stent. Multiple stones are removed using stone basket. Okay, ayan. That is basically your ureter. And this is how it really looks like. No? So, street of stones, stain straws in ureter. Oh, di ba? Murag buog man na, sir. No, it's not buog. That is basically crystalline stones. No? Makitaan dyan na nila. Ayan, gikulkog yung maayo just to make sure that they're going to get the street of stones, I'm sorry. Multiple small stones are removed using the stone basket. Ayan. Sige, i-shoot dira sa basket para ma-remove na siya. To treat the obstruction. Sige. Fast forward na to. Sige, gawas. Ano na siya, class? So as you can see, no, murag crystal jud siya. And there are times we're in sharp, no, sharp na siya dira, sharp. Ayan, so kinukuha na ngayon ng, di ba? There's like an arm getting it. Labas. Oh my God. Buti na lang may anesthesia. Thank God for anesthesia. Tuara. Gilugit. Sige, pakita mi. Okay. Ayan. Okay. So that is your stain straws. Okay. Ayan. Bruising or hematoma as well. No, from the kuanto siya ha. From your laser, not the laser, from the shockwaves nito, bruising or hematoma, and then of course your urosepsis then. Nursing diagnosis, you have your acute pain related to renal calculi, of course. Meron tayong renal colic, infective coping related to anxiety, low activity level, and inability to perform ADL. Kasi takot ka na nga masyado. It really gives you trauma talaga. kana bitawng mangihi kang pirting sakita, no? Stone pass ninyo, urine pass ninyo, stone passing, sakit kayo na siya. Makasagit. Kung ikaw lalaki, makasagit yun ka na. Kasi, by the way, class, yung stones natin, it's more common in male. Okay? Impaired urinary elimination related to renal calculi, risk for infection, yes, nutrition imbalance, less than body requirements related to nausea. Nursing responsibilities, of course, number one, for pain or for, dahil lang hindi ko makita. Ay. Ayun! Ayan. Okay. Okay. Nursing responsibilities, administer prescribed analgesics for your loin flank pain. Reassure client that most stones smaller than 4 millimeters can be passed out spontaneously. Right? Hindi masyado. As you can see in the video, di ba? May space pa talaga. No? Pero kung dagko na yun kayo siya and the sharp edges would basically lead to the damaging of your tissues. Okay? Doon sa ating urinary tract. Okay? Provide education to prevent future recurrence of the stone sa diet. Of course, increase OFI tayo dyan. What not or what to avoid, what foods to avoid, and what foods to limit. No, again, pag calcium tayo, meron tayong calcium stones, it is a very common misconception na dili na sila mag-take of calcium. No, no, no. Limit lang nato. Instruct client to avoid foods that contribute to the diagnosed type of stone. No? Yuck. Maitim ang itim, no? Tapos na tayo. So basically that wraps up my discussion on